Okay, I think we're gonna get started and people will just keep joining as we get going. But we have a great presentation today, and thank you for joining our webinar. This webinar is titled Compliance Lessons from the Patient Journey, and we get to learn a little bit more about compliance from the perspective of patients. And before we jump into introducing our speaker, I wanted to mention that we will be sending out this presentation, a recording of it, and also the slides in a follow-up email. So just be looking out for that. And also, this webinar, we're going to be doing or sending out certifications of attendance. So we'll talk a little bit more about that at the end of this presentation, but just keep an eye out for those. And let's see. I have the privilege of introducing our speaker and reading his brief bio. Jake Yates is a seasoned healthcare professional with over 15 years of experience in mental health, risk adjustment, healthcare audits, and compliance. As a compliance consultant, he partners with healthcare organizations to navigate the complex landscape of regulatory requirements and ensure compliance. Jake's expertise spans a wide range of compliance areas, including CMS audits, RAPs, and EDS claim submissions, healthcare risk management, and regulatory healthcare compliance. His extensive experience working with top U.S. health insurance plans has helped equip him with a deep understanding of healthcare compliance and Medicare Advantage, HEDIS, and RADV audits. Jake has a proven track record of delivering engaging and informative presentations on healthcare compliance, leadership, and a variety of other topics. He has shared his insights with a diverse audience, including nationwide healthcare organizations, professional billing groups, medical groups, and private physician practices. By leveraging his deep industry knowledge and strong communication skills, he empowers healthcare organizations to achieve compliance excellence and drive positive change within each institution. Jake holds a bachelor's degree in social work from the University of Utah and a master's of business administration and healthcare management degree from Western Governors University. His professional certifications include Certified in Healthcare Compliance, Certified Healthcare Compliance Professional, Project Management, and Lean Six Sigma. He is also part of the founding cohort of the Certified Artificial Intelligence Professional in Healthcare Compliance Certification Program. So with that, I will turn the time over to you, Jake. Jake, I don't think we can hear you.
Okay, there we go. Hopefully you can hear me now.
Yep, we got you.
Okay, perfect. Well, I'm actually just going to insert myself. Actually, I'll pull myself back out so I'm not quite so distracting here. So we'll just look at the content there on the screen. Thank you everyone for taking some time to join our webinar today, Compliance Lessons from the Patient Journey. As you can probably figure out, this is a very personal, very personal thing for me, specifically since this is about my experience going through some significant time in the hospital, some significant surgeries. So I've adjusted everything we're going to talk about today to be universally applicable. So whether you are part of a hospital group, whether you are a small physician practice, dental office, the concepts we're going to talk about when it comes to compliance will relate to all of those different types of healthcare organizations. So as you can see from the picture that you see there on the screen, I really wanted to make sure that this was something that drove home what I learned from this experience. Yes, there are going to be more pictures of me in the hospital. I promise none of them are inappropriate. They might be a little disheartening, but we'll go ahead and get on with the show. All right. So before we do get started, I'd love to connect and answer any questions you have. So please feel free to ask questions in the chat. Feel free to use the reactions. You can reach out to me via email or contact me through LinkedIn if you have any questions about compliance or about the presentation today. I firmly believe that compliance is a true team and community effort. So I like to share whatever helpful tips and tricks I can to make it more manageable for healthcare organizations out there. So as we look towards the webinar today, we're going to talk about 8 key compliance lessons that I learned during my patient experience. So I ended up having a total of 5 surgeries, a total of 25 days in the hospital, and these 8 lessons are things that I learned throughout different experiences. So to make it a little more engaging, a little more meaningful, we're actually going to walk through these lessons throughout kind of the story of what happened and what the end result was. So clearly I'm still here, I'm still alive, so we don't need to worry about that. But let's look really briefly at these 8 areas. So first, we're going to talk about finding leaks in our compliance programs, how we can fix those and how we can prevent them from happening again. Next, we're going to look at the importance of keeping patient information secure. So in that case, following HIPAA guidelines. How our actions that we either do or don't take can have consequences and do have consequences. How we can make compliance more relatable and understandable to our workforce. The importance of documentation, which I cannot ever stress enough, the importance of documenting things. We're going to talk about the importance of following policies and procedures rather than just having them there, having them as a nicety. We're going to talk about why they're important and how they can play a vital impact in our organizations. We're going to talk about knowing our limitations when it comes to compliance, because let's be honest, a hospital versus a physician practice or small group are not going to have equal resources to stay compliant and to help compliance efforts. So we're going to talk a little bit about how we can work around some of those things and still do our best to be compliant with regulations. And the last thing we're going to talk about is patient feedback as a tool for evaluating how effective your compliance program is. So without further ado, we'll get on to the story, since I know you are all wondering what in the world happened. So the adventure begins. I went to the hospital for a routine and very common procedure. I had a hiatal hernia repair. Just to give you kind of an idea, if you're not sure what that is, basically you take a part of the stomach, sew it to itself, and create a new LES sphincter, which is what keeps your esophagus separated from your stomach, keeps food from coming back up. Acid reflux, it's a common procedure to treat that. But to give you an idea, some of the statistics around the surgery and what that looks like, there's a 0.2% mortality rate and an 18.2% morbidity rate. So if we put that into a different perspective, the chance of dying from that procedure is about the odds, same odds as being born with an extra finger or an extra toe. And then as far as complications go, it's roughly the same odds as choosing a number on a dice and then rolling that number on the first try. So that may seem a little high when you think about how that works, but when we look at the morbidity rate, that includes any complications at all, whether it was mild, moderate, or severe. All that to say, as far as surgical procedures go, this one is actually pretty quick and pretty simple. Typically, it's about a 70 to 90-minute procedure. However, mine took 7 hours, and that ended up involving a surgical robot, multiple surgeons, and several additional medical interventions that were unexpected to get me through that surgery. The end result, thankfully, my hiatal hernia was fixed using a procedure called a toupee fundoplication. However, throughout the course of that surgery, both my original surgeon and the later consulting and participating gastrosurgeon miscalculated where my stomach began and where my esophagus ended. And that resulted in a puncture in my esophagus when performing the fundoplication. So instead of sewing the sections of my stomach together initially, there was a puncture there, and then they went on with the procedure. So despite all of the complications and things that kind of went wrong during the surgery, my original surgeon decided that he was going to go ahead and patch the hole in my esophagus. And so he did so, and then we kind of carry on from there. Recovery became pretty rough, because of the patch in my esophagus, I couldn't have food or liquids, not even one of the little sponges to wet your lips, for 3 days because we needed to make sure that area stayed dry. So 3 days later, I was wheeled down to radiology, drank some very lovely radioactive dye. But after not having anything down your throat for 3 days, you would never believe how wonderful that awful dye can taste. Unfortunately, the test took all of about 2 minutes because as soon as I swallowed it, the radiologist, the tech, and myself all watched the imaging as it was happening, and we just saw the fluid flow right out of my esophagus into my right side of my body cavity. So the patch had fallen off. It's no longer working. The liquid's not even making it to my stomach. It's diverting out of my esophagus into my body cavity. And that's really where things started to go south. So I had a 0.5 centimeter hole in my esophagus that ended up continuing to enlarge. So with all that fluid leaking in my body cavity, it started filling up and compressing my right lung. So after another quick trip back down to radiology again, I had a CT scan and they placed a chest tube in my right side. And now that I've left you all in suspense, we're going to talk about our first lesson learned and how it relates to compliance. And that's this: find your leaks. Now, you may be thinking, Jake, that's great and all, but what in the world are you talking about? Find your leaks in your compliance program. The easiest way to do this is through regular monitoring and auditing. The best and most effective way to do this, especially when it comes to HIPAA compliance, is conducting a thorough security risk analysis at least once a year, and then again, anytime you have a security incident. So your security risk analysis is really going to provide your guide for where improvement is needed in following HIPAA privacy and security regulations. I can't overstate, and you'll hear me talk about that a lot. The SRA is a very important part of compliance and knowing where your risk areas are. The second thing is conduct a mock OSHA inspection. So OSHA sometimes gets forgotten. It's kind of the tried and true. It's been around for a very long time, and everyone knows what it is, generally speaking. But sometimes we forget that there are safety issues happening in our organization that could impact not only people that are in our workforce, but also patients as well. So reviewing incident reports and looking at other things that have happened in the practice, that other issues that have happened with safety, these glean insight into what we can do to improve that and make sure that everyone stays safe. Thinking of more of a corporate compliance auditing method, internal and external billing and coding audits are vital to the success of an organization. We want to make sure, especially if we're working with the federal government and accepting funds from Medicare or Medicaid, that we're actually pinpointing our risk and addressing it. Typically, probe audits have kind of been the focus and the way to do that. But now with advanced technology and very incredible analytics tools out there, it's more effective to actually run a targeted risk management process on your billing and coding records. That way you can know exactly where your risk is and mitigate your risk rather than hoping you find it in a probe audit. The last part that is very helpful in finding your leaks is encouraging your workforce to speak up about compliance concerns. They can do that confidentially to your compliance officer, maybe a member of your compliance committee, or even through an anonymous hotline. I can guarantee that there are compliance issues happening in every healthcare organization, and sometimes we just simply don't know about them. So if your workforce knows that a report of non-compliance is going to be taken seriously and kept confidential, they are much more likely to report non-compliant behavior and, in essence, help your organization become more compliant. All right, back to the story. So after we watched my chest tube drain fill up quickly, which was the picture you just saw, my breathing started deteriorating, even though it was still draining. So we had to take a lot more aggressive action. None of the surgeons at the hospital I had the original surgery at were willing to take my case. or qualified. So I was transferred by ambulance from the level 4 trauma hospital I had my surgery at to a level 1 trauma hospital for some immediate intervention. I was about 11 miles away. I also learned that there's a very important reason why there are so many seatbelts and locking mechanisms on ambulance gurneys and in ambulances themselves, because those rides are not comfortable. Which brings us to our next compliance lesson learned: securing our information and using appropriate safeguards. Just like the awesome ENTs secured me to the gurney for transfer to the Trauma 1 hospital, we need to do the same thing with our patients' data. As some of you may know, the HIPAA security rule gives kind of three primary categories of areas we need to safeguard PHI. There's administrative, physical, and technical. Within each one of these safeguards, there's specific subcategories and items that are either labeled as required or addressable that need to be done in order to make sure we're in compliance with the HIPAA security rules. So I'm going to give you kind of a brief example of what some of those may look like in each of these categories, just to give you kind of an idea and an understanding. So with administrative safeguards, this is, surprise, surprise, something as simple as conducting an accurate and thorough security risk analysis. Again, I cannot overstate how important that security risk analysis is, especially with the rise of AI and threat actors and cybersecurity attacks. These cyber criminals are getting more and more clever, and they are, in essence, using some of these technological tools to make it easier than ever to penetrate networks and be able to take sensitive data to use for nefarious purposes. When we think of physical safeguards, the one I want to highlight is device and media controls. So this is something as simple as keeping track of any of the devices you have that have ePHI on them and making sure you know where they are at any point in time. So bonus points for this one as well, because it's actually part of conducting a thorough security risk analysis. So you can kind of kill two birds with one stone, so to speak, in this case. But basically keeping track of all those devices that have ePHI and knowing kind of what life stage they're in, whether they're being used, who they're being used by, whether they've been decommissioned and maybe a hard drive needs to be destroyed or something like that. Knowing where all of those devices are in the process helps your patient's data stay secure regardless of which end of the process that device is in. And our third category are technical safeguards. I want to highlight access controls. This is very simple. It sounds complicated. It's actually very simple. It's as simple as having a username and password that's unique to each person that accesses your medical records, your EHR, any of those sensitive documents with patient information. Could even be your billing systems. So this is an easy way for you to be able to track who's accessing ePHI, what they access, and when they access it. In fact, most EHR systems nowadays have reports and things built in to actually inform you of where these different movements are taking place with your users. So a very easy way to be able to maintain and know what your access looks like internally. Before I move on, though, I do want to mention two kind of OSHA honorable mentions, if you will, and that's medical and workforce safeguards. If there's one safeguard I saw plenty of during this experience, it was medical safeguards. Anything from bed rails to walkers, canes, heart monitors, O2 sensors, even seatbelts on the ambulance gurney. Now, depending on your organization, not all of those things, of course, are going to apply, but it gives you an idea of some of the safeguards that you may have in your organization to help keep your workforce and your patients safe. And certainly, not least, workforce safeguards. Again, these are not complicated things. They're the basics, like having personal protective equipment, gloves, masks, eye protection, sinks to wash hands in after meeting with patients, sharps containers, making sure we're correctly separating our hazardous waste and putting those in proper containers. There's so many small things that we can do that add up to a lot of protection for our workforce and our patients. So, without any further delay there, let's get on with the story. After a short 30-minute ambulance ride to the Trauma One hospital, I was immediately wheeled into the ICU, hooked up to multiple monitors, put on an oxygen mask because the nose cannula could not give me enough oxygen to keep breathing. And within 45 minutes, I was prepped for surgery, having the likelihood of survival and potential complications conversation with my new thoracic surgeon. And again, 45 minutes later, I was wheeled out of the ICU down to the surgery suite and in a second surgery. So we'll pause there to talk a little bit about how our actions have consequences. So, of course, so far at this point, the consequence of a medical mistake during my surgery nearly cost me my life. Thankfully, most of the actions we're going to take won't have nearly as devastating a consequence if something goes wrong. So I want you to consider this. When our workforce, and of course I include senior leaders, owners, board members in the workforce, when we don't follow policies, procedures, or regulations, there's going to be consequences. Not all of them are going to be severe. Not all of them are even going to be immediate. But eventually, they're going to end up happening. So let's talk about a few areas of compliance. So we'll talk a little bit about HIPAA, OSHA, and corporate compliance, and some of the things we can consider and what the results and consequences of our action or inaction could be. So first example, this is one I've actually seen a fair amount, unfortunately. Staff member takes some PHI home. Maybe they have a laptop. It has EPHI on it. And they stop by the gas station really quick. They fuel up, grab a drink before driving home. They're maybe in the convenience store for 2 to 3 minutes. In that 2 to 3 minutes, someone gets in their car, steals the laptop. Now we have a potential HIPAA breach on our hands. We can even up the ante on this too. Let's say that staff member and the organization only has certain safeguards in place. So maybe there's not a password required to sign in if the computer's put to sleep. Now that individual that took the laptop can get to potentially patient data. Now let's say it's even worse and they were working on an Excel document of patient claim information that was pulled up so they remembered where they stopped when they get home. Without a password and that security, we now have a reportable HIPAA incident on our hands. When we look at the cost of that in 2026, a breach can cost anywhere from $145 an incident to upwards of 2.1 millions per incident. So a very wide range of potential cost for not protecting patient information. For the second scenario, let's talk a little bit about releasing information. This has become a very popular topic with the right of access rule that was published a few years ago. So let's say someone sent in a request for medical records. You know, we have so many other things going on. It gets put in the pile, it disappears to the bottom of the pile, and before we know it, it's been a month or two, and the patient still hasn't received their records. At that point, they could file a complaint with the Department of Health and Human Services, and now an organization would be getting investigated for violating the right of access rule. When we look at those violations, they can cost anywhere between $50,000 to upwards of $250,000 per violation. In this case, one small action had and will have a significant financial consequence with HHS. For OSHA, this gets a little bit different. There are so many different examples I could give for this. So I just went with what OSHA has cited the most, which is bloodborne pathogen incidents. So in this scenario, let's say we've had multiple needle stick injuries occur within a year. Maybe one person grabbed a syringe by the needle when it was handed to them because they weren't looking. Someone else poked themselves trying to get a sharp shoved into an overfull sharps container. And maybe someone disposed of a scalpel in a regular garbage can, and then someone got sliced by it when they took out the trash. Now, some of those incidents may seem a little out there, but they've definitely happened. Maybe not as frequently as others, but they have happened. If these incidents aren't sufficiently addressed and then, of course, need to be reported, we can have so many consequences that come from that. Not only an OSHA violation and a fine that we need to pay, but life-altering consequences. For example, what if maybe one of those needles that was touched had hepatitis B? The individual that had the needle had hepatitis B, and the person in our practice who handled it isn't vaccinated. There's the very possible chance that they could contract it and have chronic hepatitis B for the rest of their life. And that would severely alter their life and change how they lived. Our final scenario, again, way too many real world examples of corporate compliance violations, especially when it comes to fraud, waste, and abuse. Violation of these regulations and laws are a little bit different. Not only do they result in civil monetary penalties or fines, but they can also end up getting you placed on the OIG, SAM, or state Medicaid exclusion lists, and even in some cases, incarceration. Each week, I get emails summarizing just that week's Medicare or Medicaid fraud findings, and I continue to be astounded by so many instances of fraud that are occurring in the healthcare industry today. Literally millions of dollars identified a week in fraud. And just like I experienced the consequence of a surgical mistake, when we, again, don't follow those rules and regulations, we face the natural consequences of our choices. All right, on with the story. Home sweet home. After 10 days in the hospital, I was finally released to finish recovering at home. My right lung had been heavily impacted from that puncture in my esophagus, resulting in a hydropneumothorax, which is basically just a mixture of air and fluid inside your body cavity, in this case, around my right lung. So I had to be sent home with oxygen, several antibiotics, and had to monitor my O2 levels and saturation levels regularly to make sure that we didn't end up in another medical emergency. So during that second surgery, aside from cleaning out my body cavity, my thoracic surgeon also placed a stent to help protect and let that hole in my esophagus heal, which is a standard practice when an esophageal injury happens. So we anticipated within 3 weeks or so, I'd go back, have the stent removed, life would go on, everything would be beautiful. Unfortunately, my time at home was short-lived. Less than 2 weeks after I started recovering at home, I started running a high-grade fever. I couldn't tolerate any kind of food or drink for several days. I was losing weight rapidly. My skin started turning gray. And now that I have you in suspense, we'll pause the story there for now. So this may be one of those things you're wondering, how in the world is he going to tie this in to this webinar? Well, have you ever been sick or had an infection or had surgery? I think very few, if any of us on the webinar can claim that we've never experienced one of those things at least once. Things like being ill, recovering from a surgery, they're shared experiences of being a human. At some point, let's be real, 99% of us have experienced something even as simple as a fever, a sore throat, a pounding headache, nausea, or the joy that comes from weeks of surgical recovery. These shared experiences are things that we can all understand, have empathy with, and relate to. And compliance can really actually be the same way. To some extent, every person who works in healthcare needs to know certain things, like the basics of HIPAA, OSHA, and corporate compliance. Which leads me to this rhetorical question. If so many of us have to understand these things and follow these regulations, why do violations and compliance incidents keep happening? In my opinion, the explanation is actually simpler than we might think. It's a matter of making compliance actually understandable. You figure we're trying to train our workforce on regulations written at a college level, not a plain language level. Even today, the average US adult reads at about a seventh or eighth grade reading level. So no wonder compliance issues are happening. If our trainings, our policies, and our procedures are simply regurgitating regulation and quoting regulation, we are essentially setting ourselves, our workforce, and our organization up for compliance failure. So, easiest way to fix this, we simplify our trainings, our policies, and our procedure. There's no requirement that I've found that requires your policies and procedures to be written at that same college level as the HIPAA privacy rules or anything else in the Federal Register. So if you're not certain if your policies, procedure, and training is understandable to your employees, recruit a few to read a policy, take a training, and provide some feedback. That's a great way for them to be able to help you understand and gauge the level of understanding they're actually getting from these policies, procedures, or training. Now, when my first surgeon, my original surgeon, tried explaining what happened to me during the original procedure, kind of what went wrong, he was speaking to me like he was speaking to another surgeon, full of complex medical jargon I couldn't understand. And as even though I told him I couldn't understand it, he still wasn't able to bring it down to a level of understanding for me. My thoracic surgeon, however, my second surgeon, took the time to actually bring down what was happening and what I should expect to happen at a level that I could understand and that my family could understand. In fact, he actually even drew a mock-up diagram on the whiteboard in my recovery room so I could point and ask questions about what was going on in a specific area of my body, what was happening there, and what I could do to continue recovering. And once I understood what was actually going on, recovery didn't feel nearly so daunting. And I actually understood the why behind all the IVs, the monitors, and all the medications. Now, of course, I bet you're wondering what happens next. So let's move on with our story. The week after Thanksgiving, my husband became very concerned at how quickly my condition was deteriorating and why I could hardly stay awake or even carry on a coherent conversation. So off to the ER we went, and after kind of digesting and explaining what had happened the last few weeks to my triage nurse, they gowned me back up. I was hooked back up to IV fluids, and the medications started flowing once again. Little did I know, this was still only the beginning of this journey, and the worst was still yet to come. As you can imagine, there is a lot of coordination, communication, and documentation regarding my care. There was a lot of different people that had to know what was going on, that had to understand the backstory in order to treat me effectively, which leads me to our next compliance lesson learned, the importance of documentation. So based on my symptoms, my blood work, and the state of malnutrition I was in, my local hospital care team and my thoracic surgeon decided I needed to travel back to the Trauma One hospital for much more intensive care. The unfortunate part is my ambulance ride this go around was substantially farther away. So I live about an hour and a half, roughly 90 miles away from the Trauma One hospital where my thoracic surgeon was. Let me tell you, when you don't feel good, riding for an hour and a half on a stretcher in the middle of December during a snowfall with ice in an ambulance with little to no shocks was one of the longest and most wild drives of my life. Getting back to the story, 2 days after I arrive at the Trauma One Center again, I was back in surgery for a third time. Thankfully, this one was somewhat planned because it was to remove the stent. And we were hoping, great, remove the stent, I get to go home, finish recovery. Fantastic. Little did I know, there was actually a hole on the left side of my esophagus that wasn't discovered and wasn't visible during my second surgery. It was another impacted area that happened during the first surgery. This time, that resulted in a hydropneumothorax on my left side. So a fresh new stent was put in along with a feeding tube to make sure I didn't get malnourished again. And this time I had to have 2 chest tubes put in my left side. And we'll pause the story there for a minute. Documentation is a crucial role, not only for patient care, but also for compliance. It plays such a crucial role. As the famous saying goes, if it's not documented, it didn't happen. Documentation is what provides you that burden of proof to an auditor or an inspector that you're following regulation and you're trying to be compliant. It's also your source of truth for your employees. If they're not sure what a compliance concept is or how it applies, your policies, procedures, and training should be able to help provide your staff with enough guidance to help them, or at the very least, guide them to the right person to ask questions to. There's also other kinds of documentation that are essential for compliance. For example, surprise, surprise, your security risk analysis is one of those. In addition to that, things like your emergency mode operation plan and disaster recovery plan for keeping EPHI safe when you have a disaster, even things as simple as an internet outage or a power outage. These plans help document a clear and concise pattern that your staff can follow if something happens to try and maintain business continuity as much as possible during a contingency, during an emergency or disaster. Now, documentation retention is also a very important part of compliance. I get that it may feel like you're hoarding documents and tons of data, but items like old policy versions, prior SDS sheets, exclusion monitoring results, training records, even an old security risk analysis shows the progress your organization's making towards being compliant. Again, providing that burden of proof. Just like recovery from a surgery is not instantaneous, neither is building an effective compliance program. The OCR, the OIG, and OSHA, they all have specific documentation retention requirements, which can vary pretty significantly depending on the type of document and the regulatory body. However, they all have one common pattern in them, and that is training documentation. Make sure you save on that documentation for any training that your workforce has done. Now, something I don't hear spoken about often when it comes to compliance is the importance of stating facts in the documentation and not conjecture. Of course, when we have cases like a compliance investigation where we need witness statements, personal opinions and insight are acceptable because that's all that person has to provide is their first person account of what happened. Keeping that documentation as factual as we can helps keep it straightforward and not vague. Statements like, any employee who violates this policy will be disciplined, or employees who report compliance concerns will never be retaliated against, are all clear and straightforward and pretty unlikely to be misinterpreted. Finally, make sure your compliance documentation is accurate and that it's thorough. For example, when we look at these two chest x-rays, a note saying, it looks like there's something wrong here, versus these x-rays were taken 45 minutes apart, showing a worsening left-sided pleural infusion in the left lung requiring washout of the left pleural space. Yes, these are my x-rays, and that will lead to our next part of the story. That's not to say everything needs to be so clinical sounding, but you get the idea. Being vague doesn't really help us, but if we're more precise and accurate in our documentation, it can better help us identify potential compliance issues when we look back on it. All right, a few days after my third surgery, the occupational therapy team had me up and walking the floor with my IV stand, 2 chest tube drains, and a portable suction device to keep my left side from continuing to fill up with fluid and discharge. This is also when another major medical mistake happened. A few hours after returning to my room, I started having difficulty breathing. The nurses, the PAs, my NP, my surgeons all kept a very careful eye on it, but about 7 hours later, I couldn't get out 2 words and before I was completely out of breath. And that's when they took the x-rays that you just saw on the previous slide. So one seemingly insignificant mistake was made that resulted in this. When the occupational therapist returned me to my room, the suction for my chest tubes was not turned back on. That one simple incident, an instance of not following a procedure, resulted in a 4th surgery to go back into my left pleural space or that space around my lung and suction and clean everything out a second time. Now, the compliance lesson here likely hasn't escaped any of you. It's the importance of making certain that policies and procedures are actually followed. That can't be overstated. Policies and procedures are truly the foundation of an effective compliance program because they do make a significant difference on whether an organization is or isn't compliant. They are what really drive the direction and focus for your workforce. For things like what is and is not acceptable, how certain procedures should be done, or how we need to conduct ourselves in certain situations. In my case, a lack of following the procedure could have resulted in my death again. But for most of us on this call, again, not following policies and procedures will likely not result in someone's death, but that doesn't mean they don't have serious consequences if they aren't followed. We saw a glimpse of this just as the financial consequences of HIPAA, OSHA, and corporate compliance regulations from a few slides back. So, there will be consequences that will come. For organizations, especially smaller healthcare organizations, some of these fines and consequences of non-compliance could be the difference between keeping the practice open or having to shut the doors to pay for the fines. We've had that happen with some of our clients. Unfortunately, we've seen that happen all too frequently in the general healthcare population. So it's important that we make sure that we are following our policies and procedures because they are that foundation of an effective compliance program. Now, when we think about policies and procedures, we don't need to have them overly complicated. A simple policy that can be followed is better than any complex policy that can't be followed or isn't followed because of its complexity. So if you have hundreds of policies, consider segmenting them by department or by a user's role or an employee's role. Not every policy is going to apply to every workforce member. So rather than overwhelm everyone with so many policies, we should limit them to only what the role or that department calls for. Because then again, if the number of policies feels more digestible, more of your workforce members are likely to follow them. All right, now back to the story. After surgery number 4, to suction out that left pleural space and readjust the clip and my stent, put that back in place, recovery started to get better, thankfully, albeit it was very slow. By this point, I'd actually developed 2 types of sepsis, a microfungal infection and blood loss, enough blood loss requiring a transfusion, and I was still having fluid being drained from around my left lung. Each day kind of started to feel a little bit like I was living in the movie Groundhog's Day. At 4 a.m., I knew I could count on the radiology techs to come in with the portable x-ray to look at my lungs. At 5 a.m., I could count on the phlebotomist to come in and take my blood sample. And at 10 a.m. and 2 p.m., I could count on occupational therapy to walk in and take me for my walk. Recovery definitely is a journey. During this entire experience, and even today, I've really learned the importance of knowing my own limitations. I know some days I would be too sick or too weak to take both walks on the hospital floor. And even today, I know if I drink anything carbonated or have more than a small bite of food at a time while I'm eating, that I'll likely start choking on it and won't be able to get it down. So I have to very carefully watch what I eat and especially avoid carbonation. Compliance can be very similar. Each of our organizations is going to have different strengths and weaknesses and vulnerabilities. Sometimes we have limited resources. Sometimes we have sufficient resources. Regardless, we're all required to follow the required and addressable regulatory requirements. So if your organization can't afford encryption for your emails right now, then we find an alternative way to send that PHI. Maybe we need to send it via a courier. Maybe we need to send it via mail. Maybe we just have to take care of finding another secure way to send it, maybe through an SFTP, or something maybe like paying for a facility inspection. We can find alternative tools. For example, the tool on OSHA's website that can help you Take your own walk through your office to see what areas you need to examine and what areas you need to correct and make corrections. Compliance is really a journey, not a race. So don't fret if you can't implement every single regulation immediately. Instead, take the data you get from monitoring and auditing to tell you what you should focus on first. Again, another shameless plug to make sure you conduct your annual security risk analysis. That monitoring and auditing is what's going to help you know where you're falling short and what needs the most attention in your organization and with your compliance program. Just like a significant part of recovery, compliance is a learning process. That includes making mistakes. There are going to be plenty of mistakes and setbacks along the road to being more compliant. And honestly, that's great. The important thing is that we learn from those setbacks and those mistakes. One of my favorite compliance phrases that I use is never let a good crisis go to waste. There are varying versions of that phrase that have been attributed to so many different people that I wasn't going to list them all here. So the sentiment is still the same nonetheless. When we use our mistakes to become better and improve our compliance program, that is what's going to drive it forward. If we have a HIPAA breach, take the time to find out where the gap was, address it, and then make a plan to prevent it from happening again. Failures, mistakes, and crises are all valuable tools if we actually allow them to be. And finally, don't expect perfection with your compliance program. No one is ever going to be 100% compliant 100% of the time. So if you're feeling stressed or frustrated that you're not getting there, cut yourself some slack, give yourself some grace, because no one will ever get there. Start with having achievable goals with your compliance program. For example, maybe your goal as an organization is to make sure every person takes their compliance training within that year. Great. That is a perfectly achievable goal and one that you could turn into being 100% compliant with. Every person took their training. Even something like reviewing all of your policies once per year. Again, another thing that's achievable if we break it up throughout the year. We can achieve 100% compliance with reviewing our policies annually. My body finally started to heal enough that I was finally able to return home, now having a total of 4 surgeries and 24 days in the hospital. However, just because I was well enough to leave the hospital didn't mean I was truly well yet. Just a few hours before my discharge, the infectious disease doctor came in and said, hey, we've got to put a PICC line in your right arm because we need you to administer some specific medications when you get home. So now I had to have a PICC line installed in my right arm, in addition to the 15 plus other medications and my feeding tube nutrition. You would have thought I was opening up my own pharmacy or even a medical equipment store from what I had at home, but thankfully, I was finally actually starting to feel like I was getting better. With all the time spent in the hospital, I worried a lot about not being at work, not being able to be here with my compliance team during the very busiest part of our year, for which I cannot apologize enough for them for. During all of that time being stuck in the hospital or at home recovering, no wonder I had plenty of time to think about my experience and realizing that it was not unique to just me. It was unique that I was a compliance professional who knew the rules, knows the regulations, and was also able to carefully observe how incredible the nurses, the MAs, the PAs, the NPs, the physicians, and the surgeons at the hospital were. Even though they could all easily pick me out in a lineup and knew a lot about me, literally every one of them knew my parents' names, my husband's name, my family members' names, my name. They knew I had a cat at home. They knew everything about me because they had seen me so much. So it was almost like walking into an episode of Cheers or Friends, because everyone knew who I was and was asking questions. But even though they knew me that well, they knew who my family members were if they were in my room, if they came in to talk about my condition or anything relating to my care, they still followed the procedure and asked my consent before disclosing any of my health information if someone was in the room. They made sure things like the computers were locked. Anytime they weren't directly staring at the screen, that computer got locked. They helped me understand what my rights as a patient were and took my health information seriously and the privacy of that information, which brings us to our final compliance lesson, the importance of patient feedback in your compliance program. Whether we care to admit it or not, patients are often more observant than we actually give them credit for. Some, like me, are carefully watching and observing, and unfortunately, and maybe fortunately, give some very direct feedback. But the summary of that is that the patient perspective matters. Yes, not all patients and most patients are not going to be well versed in healthcare compliance as our own workers are or as a compliance officer would be, but they know enough to know when something's right and when something isn't right. So I encourage you to take the time to ask your patients questions that you can trace back to your compliance efforts. Questions like, do you feel we've kept your information appropriately private today? Did you observe anything that made you feel uncomfortable? Or even a question like, do you have any concerns about your visit or your health information and how we're protecting that? If they don't answer positively or in the affirmative to questions like that, we know there's likely a problem in our compliance program that we need to address. The other way patient feedback can help us improve our compliance program is through patient complaints. I know that kind of sounds maybe not quite correct, but when you think about it, every healthcare organization should have some type of patient complaint policy and procedure to follow. In fact, complaints are directly addressed in the HIPAA privacy rule and include information on how patients can file complaints. For example, that's a requirement in your notice of privacy practices document. It needs to state how a patient can file a complaint if they feel their rights have been violated. Complaints are another way, again, to tell whether your compliance program is actually being effective. If you're getting complaints about patients overhearing their PHI being discussed loudly out in the main area or in the hall, or they get the wrong record sent to them, or they're waiting months to get copies of their medical records, you know there's a gap and something is not working right in your compliance program. So take patient complaints seriously and don't be afraid to ask questions about how patients feel you're doing, keeping their information safe and secure. All right, finally, January 8th, 2026. So what, about 6-7 months ago, I went to the Trauma One Hospital again, bringing my hospital stay up to 25 days, and I had my 5th and final surgery in less than 2 months. Hallelujah, everything was healed. It looked good. I got to have my stent removed. I had my feeding tube taken out, and I could go back to at least eating soft foods instead of being on a liquid-only diet like I had been for the previous 2 months. Unfortunately, still had a few more days that I had to be on oxygen at home to help my lungs continue to expand and get used to filling that space again. Still had to take a lot of medication, rest a lot, but I finally started feeling like myself again. Recovery is an honesty about this before the webinar started, that I'm grateful to be alive. Please don't get me wrong. I'm very grateful to be alive. And even though this was one of the most painful and difficult things I've ever experienced, I'm grateful for what it taught me both professionally and personally. So although, a lot of this took place in the hospital or while I was receiving home health care, a lot of these principles are still the same. Our compliance program needs to be applicable to our workforce, and it needs to be conveyed in an understandable way. Workforce members need to understand the why behind compliance by making it understandable and relatable to them. This is especially important when it comes to our policies, procedures, and training in our organizations. Again, the importance of monitoring and auditing our compliance program, documenting our findings, fixing any of those leaks we find. We have to understand that our resources, again, are not limitless. It's important to know where our limitations lie and find ways we can still be compliant despite what we can't control or what we can't afford to do. And finally, we need to make sure, again, we remember the why behind compliance, and that is the patient. The trust they place in us is not only to help heal them, but also keep the sensitive information they're trusting us with protected and safe. And with that, I hope you guys have enjoyed the webinar today. I hope something you're taking away has given you some good ideas of how to improve your compliance program, or even just one more step towards becoming more compliant. So if anyone has any questions, we'll open it up for questions for the next few minutes.
I don't have any questions yet in the Q&A, but I just have to say that Jake, I know that everyone here at HCP is so happy that you recovered and back with us. I don't even think I knew the depth of the journey that you went through. So thank you for sharing that with everybody today. And I think it's really cool because it really shows how compliance is kind of this living, breathing thing that affects people, right? And you don't necessarily realize it until you're in your spot and you're in the hospital and you're like, oh my gosh, like all of these things have to work together and from the beginning to the end. And so it was cool to see it from that perspective for sure. I know Josie, I think we'll talk about the certificate of attendance because that was most of the questions that we had was on kind of what we'll be sending out.
Oh,
Um,
perfect.
but let's see.
Okay, perfect.
If
And
you
I'm
have,
happy
if
to.
anyone does have questions, you can put them in the Q&A. So we are looking at that. Um, let's see, we have just some people making comments. Such a journey you went through. Glad you had so much support and that you're alive and healthy. Great message and insights from the patient point of view. So glad you recovered and back to health. Thank you for sharing. And I know Jake will probably mention this, but if you think of any questions after, you can always, Jake has his email right on there. So you can email him, reach out to any of us at HCP. But Jake, I'll let you share your
Yeah,
last thought.
yeah, absolutely. So a copy of the slides will be sent out. Like Josie had mentioned at the beginning, we're also sending out a certificate for participation that will come along with the slides. This webinar today has not been pre-approved for CEU or CME credits. However, I always recommend sending that certificate or a copy of the slides to any accrediting or education body. A lot of times they will provide at least some credit for attending and becoming more informed about things like compliance. So I encourage you to submit that to, again, any regulatory bodies or folks where you need to earn CEUs or CMEs to at least see if they're willing to provide some type of continuing ed credits in those cases. But yeah, thanks, Nicole. Again, thanks everyone for joining the webinar today. I appreciate you kind of coming along this journey with me and learning a little bit more about compliance from the patient perspective. I share lots of compliance content on my LinkedIn page. I am a compliance nerd. I am not afraid to admit it. So if you ever have compliance questions, if you're preparing for an audit or are just looking for a breakdown of compliance in understandable concepts, please feel free, follow me on LinkedIn, reach out to me via email. Happy to be a connection and a resource for everyone out there to help you in your compliance journey.